Okay, now we're going to cover the actual installation of the Heliox blender onto the Heliox cylinder. So what we'll do is we'll remove the cap. And we have a clamp, and this clamp is to interface the pole that's going to hold the Heliox blender on here. When this is ordered as a kit, there actually comes 2 clamps so that when you bring your new cylinder up, you put the clamp on, you move the regulator over, and then you can take the pole and move the whole setup over to your fresh tank of Heliox. So we'll put this pole in, and there's actually three holes in this pole, and that's to fit the different angles that the tank may sit at. So in this case, we'll use the straight up hole since the tank is sitting straight up and down. The one thing that you probably want to do is make sure that, depending if you're using this tank standing up or back on its holders, so that you want to make sure that the blender is straight up and down and that the flow meter sits straight up and down. So that's why there's those 3 holes in there, to change the angle of the pole to match what angle of the tank that you're using it at and the cylinder that you're using it at. So from there, what we can pretty much do is hang on our Heliox blender from here. This goes on to the lower pole clamp. And with our blender, we have our oxygen flow meter conversion card that we can talk about a little bit later. But I always affix that to one of the flow meters. And it really doesn't matter what flow meters that we put on here. These happen to be 2 0 to 15 liter flow meters. This low flow Heliox blender, this is an 80-20 blender, and at a flow of, this is rated for 0 to 30 liters a minute of oxygen flow, but with Heliox flow and with the 80-20 concentration, we can get a maximum concentration of about 54 liters per minute through this blender. So really a low flow blender is really good to use in terms of dealing with patients non-invasively. So the masks, nasal cannulas, doing aerosol treatment, those type of things. So the low flow Heliox blender is really the choice for a lot of different applications. High flow blender is used for when you need much more than 54 liters of flow. But like I said, for the most applications, Heliox is good for the low flow blender. We can then place our oxygen monitor in here, because we do recommend that you analyze the oxygen concentration in the monitor. So this can be done on a spot check basis, depending on what device you're using, or it can be done continuously. The one thing that you want to make sure of, if there's any humidity, that the cell on the oxygen monitor is on the dry side of the humidity, and that you don't put the cell, say, in line with an aerosol treatment or a small volume nebulizer treatment, because that back pressure will affect the accuracy of the reading of the FiO2. So from there, we can install our hoses, our high pressure hoses. We have our oxygen hose, and this is a male into a female connection. So our inlets for the blender are on the bottom of the blender. So this will then get installed to the wall. And then from here, this is our Heliox connection. And again, this is our Heliox hose. It's a white braided or clear braided hose with white in it. Both of these connections that are on here are Heliox connections. This inlet is not an air connection. It's an actual Heliox connection. So we can install these hoses, one to where normally the air fitting would go, but in turn, this is the Heliox fitting. And then this will go on to our regulator. This is our Heliox regulator, 50 psi single stage regulator, CGA connection, DISS fitting. So the CGA connection goes on to the tank. And to note that to use this blender, a 50 psi regulator has to be used all the time. You cannot connect, first of all, this is DIS and this is CGA. They should not mix. But anytime you're using a cylinder with a blender, you have to use a regulator, so to reduce the pressure down to 50 psi. So this is our DISS connection onto here. So our Heliox blender, you can see, is installed with the regulator in place. From there, we can connect up to the wall, get the tank going, and start our therapy.